Okay. Awesome. So today we're going to talk about how to make knee arthritis go away. And really the title is a little bit misleading because we don't necessarily make arthritis technically go away, but what we find in a lot of our clients is that arthritis is not really the driver that's causing the pain. It's really some other things that we'll be talking about. So that's what we're going to talk about today. So my name is Stephanie. I have been a physical therapist, just so you know a little bit about me, for almost 20 years. I swear to God, I don't know how I've been in this for 20 years because I feel like I'm not that old.
Knee pain, but
I'm
just trying to get a feel for.
If someone could turn their volume off. Yeah, awesome. I was someone that was super active growing up. I was a competitive gymnast. I went on and played soccer and then chose soccer and went into play college soccer. I was in the doctor's office all the time with some sort of injury, but when I played soccer in college, I ended up having a meniscal tear, and it really was a meniscal tear. I ended up having to have surgery, but when I got out of college, I had another knee injury, and they couldn't figure out what it was or what was going on, and they said, well, let's just scope it and clean it out. And I wish I never would have had that. I wish I would have known what I know now, because it actually made my knee worse. And that's really one of the things that we're going to kind of talk about today, is that a lot of the things that that we see with knees and really other parts of the body as well, is that our body has an amazing ability to heal if we give it the right environment, if we get to the source of the problem. And we're going to be talking about some of those things. But I'm going to introduce Hillary so she can talk about herself as well. So Hillary, go ahead and give us your background.
Hi, everyone. Thanks for joining us. My name is Hillary, and I've been a physical therapist for 4 years. Like Stephanie, growing up, I was always very, very active. I'm continue to run, and I ski raced in in high school. And then I continued to ski throughout college and played lacrosse. So really active. And things would come up here and there. And I would kind of figure out a way to kind of rehab through it. And I never actually went to PT, which is pretty funny because everyone asked how I got into it. But I was in the athletic training room and always just so interested in the body and how it worked, and really trying to figure out how to avoid the surgeries that I would see some of my friends getting and that type of thing. And then I focus on postural restoration, which really looks at your posture and patterns, and how one thing like the pelvis can influence your hips and your knees and all the way down the chain. So looking at kind of the whole body picture of things.
So today we're going to talk about why pain pills, medications, injections, and surgeries don't always work. We'll get into some of those things. Why MRIs and imaging leads down a path of unnecessary procedures. We'll talk about that. What healthcare providers miss in helping you get back to living your life and staying active and mobile. And then really, is arthritis really causing your knee pain? And so we'll talk a little bit about that. So ways how we can help. So I always tell people, and you'll hear me say it all the time, and anything that you hear me do, is where the site of the pain is often not where the source of the problem is located. And so one of the things that happens, and we'll get into more of this, of what healthcare providers do, is you go see a doctor and they only look at your knee. They don't look at anything else. You go to a PT and they only do knee exercises because the doctor put knee pain on it, and that's all that you do. They don't look at, kind of like what Hillary was saying, they don't look at the pelvis, the hips, the back, the ankle. Like, these are all things that can influence how the knee feels. And that's one of the things that that is a problem in our healthcare system. And then I also want to just a short brief moment is just mentioning that we have a special offer at the end of this. So you will learn ways of how you can talk to one of our specialists for free, as well as some other special offers. So stay tuned to the end. So when you look at the causes of knee pain, there can be a lot of causes of knee pain, but when we look at like how the body works, The first thing I always say is you have to look at the mobility piece of it. If you don't fix the mobility piece, and you skip that piece of it, and we're going to talk about what that is, and you go to the muscles and doing strengthening and those kind of things, you're going to miss the boat. And so what I mean is, how does the knee joint move? How does the back move? How does the hip move? How does the ankle move? Because if these don't move very well, it can all affect the knee. I mean, I had a client literally, she's a dancer and she is on a drill team. So they do a lot of kicks. And her mom called me and goes, oh my gosh, her knee's bothering her. Can you come see her? And I was like, oh, interesting. And before in the past, she had other issues in her knee, or actually in her hip. So I was like, well, we'll see. Well, we're going to check the knee out, but I'm also going to check the hip out. So her knee wasn't moving very well. She couldn't even do a deep squat because it hurts, even when I saw her. And so I went and started working on the knee, and it really didn't make any effect. I'm like, let's go to the hip because I know it's not moving as well, and it wasn't. And so we started doing some hip kind of mobility exercise, like like joint mobs type thing with some soft tissue, some things that we do up here to improve that mobility. And as soon as we worked on her hip, she was able to squat fully down. Her knee range of motion improved, and that's where it was coming from. It was coming from her hip. So when we look at the mobility, we've got to see, like, how does the back move? How does the hip move? How does the ankle move? How does the knee move? Because if one doesn't move, you're going to feel it in the other part of the joint. And that's one of the things that a lot of people don't do. They just look at like the side of the pain. Other things are muscles. So the next phase would be like muscle imbalances and movement habits. So where are some of those weaknesses that we see? So we've got to work on those muscles, individually, and then we've got to put them together in more of like a functional, like movement patterns, those kind of things, to make sure that you can squat correctly and you're not compensating, or whatever it is that you're wanting to get back to doing. We start working towards exercises, break down the movement to get you back to doing some of those things. And then other things you look at, like sometimes we have people and their mobility looks really good. Like everything is moving fantastic, but they have a lot of muscle tightness. It's just tightness. Like they have tightness in their IT band or their TFL, the muscle part of the IT band. They have tightness in their hips. They may have tightness in their hamstrings, their quads. These all can affect their muscles. But when you have some of those tightnesses, you got to go into like, why does that tightness happen? Why? Like if it's just tight because it's just tight, like because you worked out really hard. Okay, that gives us an idea of like, okay, you just worked out hard. We release this, you're going to be good to go. But normally people are coming in, they've been, dealing with this for a while. So what is it that they're doing that's creating some of that tightness? And that can go into, if the mobility is normal, that can go into what does their movement patterns look like? What strength do we need to look at to improve, because maybe they're compensating using muscles they shouldn't be using. So again, we always go into like the why. And then back pain or hip pain, like those literally, if you don't rule out the back and the hip for the knee, you're missing a big component. And you can have a combination of things. It can be a back and hip component, and you can have a knee component. You're really having to look at everything and kind of putting everything together.
Yeah, just off of that, I had a patient come back in who was previously in here, had some back issues and just kind of was feeling his back a little bit, but it was really his ankle. He said, oh, my ankle is bothering me, my knees are bothering me. So knowing that he's had some back issues in the past, we have to kind of think about, okay, sometimes the back can cause the knee and the hip issues. So when everything starts, you rule out the ankle, you rule out the knee, and those are moving well, sometimes you do have to go to a joint you wouldn't expect, like the back. So we're kind of trained to look at that and see if that's the issue.
Yeah, everything's connected. And there's times when I'm like, how the heck? Like, I guess that's so crazy. Like it worked, because it's like they weren't complaining of any issues in their hip or their back or whatever, but you still went and did some mobility stuff and it resolved it. And you're like, oh, dang, this is why you have to rule it out. That's why you have to rule it out. Next slide. So let's get into medications and injections and why they don't always work. So I like to tell people we feel pain 3 different ways. We have mechanical pain, we have thermal pain, we have chemical pain, and then we're going to talk about a little bit of the other ways. So thermal pain would be like burns, sunburns. Let's take those out of the picture. Not something that we address. Chemical pain and mechanical pain are definitely things that we address. And this is when and I always say, like, in our healthcare system, we tend to treat the symptoms. So we have pain, we automatically want to give someone pain pill, we automatically want to do an injection. But how do we know that their pain is coming from chemical pain? So what chemical pain is like when you have an injury, you have swelling that comes in the area. Those are all the chemicals that come into the area. And it's a constant pain. Typically it is. It's constant pain. It's throbbing. It's aching. A lot of times you can't change your position to make it better or worse, maybe a little bit. But it's that, anytime you've had inflammation, you just feel like the joint is red and it's swollen. That's chemical pain. Chemicals can treat chemicals. So if you have mechanical pain, and that's when something is like the joint's not moving very well, the muscles are tight, the way your body is moving is not correct. Like those are all the mechanics of how everything works. You can have mechanical pain that is constant pain, and you can have mechanical pain that is that comes and goes. So, you can ask questions to really figure out, like, do I need medications, or is this something, or an injection, or is this something is it not going to work? So a lot of the questions I like to ask. So we know chemical pain is like, it happens all the time. So I always ask the patients, like, tell me, like, does your pain come and go? Or is there any time throughout the day that you don't have pain? Yes. I can do this and I don't have pain. Awesome. We already know that it's mechanical pain. That's something that we can address. It's not chemical pain. So if they were to go and get injections or medications, it's not going to do much for them. It might take a little bit of the edge off, but it's not going to do much for them. Other questions you ask are, can you change your position and make your pain better or worse? Again, that's very mechanical. That's when the drugs also will not help and injections also will not help. So if you think of like those 2 questions and you ask yourself, even if you're going to a doctor to figure some things out, that these are not going, like, you can ask those questions to yourself and be like, yeah, I don't think that it's going to work if I do drugs or these injections. I think I just need to find a really good physical therapist. And so you can kind of navigate the healthcare through that. Now, there's other two ways that we feel pain that we see in our office. Doesn't happen as much, but they present very differently. And one's like autoimmune type pain, and one is like emotional. There's an emotional component to your pain. Autoimmune will be really weird symptoms. You improve everything, like that. Like if they come in and we have baselines of things that aren't moving, things that are weak, and all of a sudden we're getting everything to move and it's still not getting better, but their symptoms are really random. There's no patterns to it. We start going into a little bit about, like, are you having some stomach pains? Are you noticing that you're getting a lot of bloating? Are you noticing a lot of fatigue? Like, you'll start asking questions and then you start navigating that. Oh, there's definitely a component that might be a little bit more autoimmune. And we can kind of tell once we've kind of gone through our evaluation. Emotional components will be more of, like, you'll hear patients say, I went on vacation and I felt fantastic. I got home and all my pain came. There's an emotional piece to it. You'll ask questions like, their pain, like everything is improving, but all of a sudden their pain got worse. Tell me a little bit about what's happened this week. And all of a sudden they've had these stressful events that have happened. And you're like, there you go. We've got to address this. There's a component here. So you've got to get to the source of the problem so that you can get to feeling better, and understanding all these kind of components are going to help you. Hillary, do you have anything else to say?
And then just kind of talking about mechanical pain, because a lot of times that's really what we're treating first. You can have mechanical pain in different ways. There can be pain referral from the muscle that can refer, your muscle can refer to another area in your body. So we could have a muscle that's really tight in our hip that's referring down to our lateral knee. And that can feel like a weird, like, I don't know why, like my knee hurts, but it can be coming from the muscle like higher up in the hip. And then also the nerve pain is a different kind of pain. So there's those two main types that we'll really see. And that nerve pain is going to be more like kind of hard to explain, like a burning, funny feeling. Like you can sometimes feel like there's like a heaviness or itchy. Those are just some of the words that come to mind from what patients tell me. So there's those two different types of mechanical pain there. And then you can get like that deep ache in the joint pain too. Yeah. And just another off of the emotional pain. Like I just had a patient who I've been treating, and, you know, she's like, I figured it out. Every time I get in my car and I drive to work, I feel my pain. So there's definitely that, like, stress is causing some of her mechanical pain to get worse.
Yeah, you'll see it. And when things don't make sense, you dive deeper into questions. You can really get really our job as a physical therapist is to bring awareness around the problem. And so just bringing awareness of like, what else is going on? And then like, yeah, when I drive to work, okay, so we need to start addressing, like, you need to change your mindset around driving to work. Otherwise you're going to continue to have this problem. And so it just gives us, it helps. We can help our patients by bringing awareness around what truly is going on. And it's a multifaceted approach. I mean, it's not just one thing there. It's, you know, you really have to dive into a lot of things.
Yeah. Multiple causes to your pain.
Yep. So why surgery leads down to more surgeries. So a lot of times, you know, I'm just going to talk from the knee perspective. Honestly, if you're over 40 and they want to do what they consider a clean out of the knee, which is basically they go in, they scope it, and they clean everything up, I would highly recommend not doing that. It can actually make you worse. The research on it is not great. Like they literally have research where they went and they took people that and scoped their knee and cleaned it out. And then they did another group of people where they just basically poked the holes in the knee and they didn't do anything. It just looked like they had surgery. Well, the people that they poked the holes in the knee and didn't do anything to their knee all did so much better than the ones that actually had the surgery. So like when you look at some of the research, the clean out of the meniscus, literally like a year down the road, they're worse off than just general exercise. And again, a lot of it comes down to people are not getting to the source of why you're hurting. It might not be your meniscus, or maybe there's things that can mimic a meniscal tear that we call them derangements in our office, but that's kind of like we have fat pads in the front of our knee and they can really mimic a meniscal tear. It can mimic like you don't have full range of motion. It feels like your knee locks up, your knee gives out on you, but it'll be very predictable. But also, like you'll find it that some days it's like, I feel fine. Like I don't have any problems. And other days I can barely walk. I'm like, okay, that let's go and make sure we can rule out and figure out, like, is that really what's going on? Or is there something else that we can fix that is going on? Other things are, they actually have research too with people in line for like a total knee replacement. And they basically went and put them into kind of two categories. They put them into one category where they did some knee mobilizations, similar things to what we do in our office. And then they put them into categories of general exercise. So if the knee mobilizations seem to be like, that's the direction they need to go, that's the category that they put them in. If that didn't help, they put them in the general exercise category. Well, of the people that were in line to have a total knee replacement, 40% of them had full resolution after doing knee mobilizations, going in the right direction. Like, and their resolution was like within 4 to 6 weeks, they were back to fully functioning. 40%. And we had a client that came into our office and she was, skeptical about coming in. I don't know if you can help me. She tried, some of the stem cell in her knees. The doctors wanted to do a total knee replacement. She did injections. She did all these things, and she wasn't getting any better. And I asked her, well, what's your biggest complaint? Like, what is it that you are missing out on? What is your, what is it that you can't do? And she says she's just so tired and fatigued that literally like doing one activity wiped her out for the day. And I said, well, how do you feel like having a knee surgery is going to help you with your fatigue? And she said, I don't know. Like that, I was wondering the same thing. So she ended up coming into the office and we saw her and we got, her hip was not moving, got that moving, got her knee moving, and then moved her on to our Pilates program where she was so fatigued. Like she literally in 30 minutes could only do like 3 or 4 exercises. Now she does classes all the time and she doesn't even think twice. Like she can literally go out and do 5 errands, no problem. She's walking with her husband every single day. She sometimes, will still tighten up, but she knows what to do because we showed her what to do. But these are some things like you have to really dive deep into figuring out like what is really going on, like where is the pain coming from? Otherwise, you'll have surgery on something that might not have needed surgery at all.
Right. And then if you have that surgery and you go through like 3, 4, 5 months of rehab, trying to get your motion back, trying to get your quad back and strengthen around it. And then sometimes you could still have the pain because that wasn't the issue. Then you wasted all that time and energy, and not to mention it's expensive. So always, looking to try maybe that conservative route first before jumping into a surgery is key for sure.
Yeah. You can't take the surgery back,
Yeah.
but you can take the physical therapy back and say like, this didn't work, but it didn't make me worse. Well, hopefully it didn't. Usually doesn't in our office, but, but you can't take the surgery back. I wish I could take my first surgery back.
And I saw a patient who had a knee scope on her right knee. And then she came in to us actually for her left knee, and she was rehabbing her right knee and it was getting better, feeling better after her surgery. But her left knee is what she came in for. So we start working on her left knee, 3 weeks, feeling so much better, back to what she needs to do. And it's really her right knee now that had the surgery that's limiting her from what she needs to do, because we have to work on that motion. There's scar tissue in there and it's tight. So it's just, who knows, she could have maybe avoided that surgery, that scope.
I would have said she probably could have,
Yeah.
just knowing her age. And I think she says the same thing now. She wishes she came in before.
Yeah. Mm-hmm.
But anyway, we'll help her. She'll get back.
Yeah.
So MRIs, everyone, one of the first questions is, well, do I need to get an MRI or do I need to bring in my MRI? And my question is like, well, you can, but I'm not going to really base anything off of it. When you look at the research on MRIs, it is not great. Because, let's just take the knee. This is with all body parts. But you can image people that have no pain whatsoever, 0 pain. And this is just across like multiple, literally when I was having to go through this program that I went through, I had to read a ton of research. And I was like so shocked at research after research after research saying the same thing on imaging. I'm like, I cannot believe that this is our first defense of what we do with people, because it's very expensive, first of all. And second of all, it doesn't really give us that much information. So when you take people that have no pain, let's say like 100 to make the numbers really easy, no pain whatsoever, and you image them, 60 to 80% are going to show something, from a meniscal tear to degenerative changes. But these are pain-free people. They can do everything. There's no problems. And part of what happens is that as we get older, we just start aging a little bit. It's just what happens. It's kind of like we get older, we get wrinkles on our face. It's just a part of aging. Well, the things that happen that we're imaging are just a part of aging. So when we have these aging things that are happening and we're imaging them and we have pain, then all of a sudden the doctor's like, this is what needs to happen. It's true even for rotator cuff tears. I know it's not, we're talking about knees, but like even people can have rotator cuff tears and they're fully functional. And baseball players, most of them have rotator cuff tears, but the tear may not be like when you're hurting and you have that, it may not be what's going on. So you really have to take MRIs with a grain of salt. The only time that we send people to MRIs when we start seeing red flags, or usually what I'll have people to ask the doctor is, so how is this going to change what your decision is on what I need to do for my next steps? If it's not going to change your decision, you're just going to send me to physical therapy, then why do I need to get an MRI? Because let me just go to physical therapy. But if it's really like, let's just make sure that, like for instance, I think I might have torn my ACL. The testing is looking pretty positive. Let's go and image it to make sure that there actually really is a tear, because I think we're going to have surgery. So yes, that's when an MRI should be used, but it shouldn't be used as a first defense of, let's see what's going on with the knee, which is what happens in healthcare.
And if you did get an MRI, I mean, we'll look at it, and it's good information to have. But we're going to look at it as if you didn't give us the MRI, and we're going to try and figure out where your pain is coming from and the source of it without kind of knowing that. Because it's most of the time, it just gives you way too much information.
And again, you could image, they're only imaging the knee, but what if the problem's coming from the hip? What if there's a problem coming from the ankle? Like, you can't image the whole body to figure out what it is. And in the healthcare system, we literally have lost critical thinking of like, okay, does this make sense? Why is this happening? Like, constantly asking questions. We've lost it because no one has time to spend with you. And I honestly say, I was talking with a patient today, and we were both like, she was having some issues, and she was like so frustrated with her doctor. And I was like, yeah, I tell people all the time, like, I don't understand how you can come up with a diagnosis in 5 minutes, because I can't do it in 30 minutes sometimes, because you're like looking at everything, trying to figure out, well, where is this coming from? So it's really difficult to really get a true assessment in a short period of time. So what do other healthcare providers miss? So one of the biggest things is lifestyle changes, because sometimes it's like, for instance, the person's driving in her car and she gets her pain every time she goes to work. Well, there's some changes there that we need to make, because we need to make, she needs to make changes to like her mindset of what she's feeling for work, so that she doesn't have those issues. Or maybe it's, for knee pain, they want to cycle and they're having some issues. Well, we've got to address and look at, like, if they're still like, if everything is feeling good and they're still having some issues with cycling, we've got to look at like, what's their form look like on the bike? So maybe they're like doing some compensation patterns that we need to look at. We've got to give people tools. So if it's like, I want to go out and walk because I'm going to go on vacation, we've got to give them tools of what they can do if some things do kind of pop up. Other things are, we only look at the side of the pain. So we are only going to look at the knee. Happens all the time with physical therapy, with chiropractor, with doctors. I mean, nowadays it's like, yeah, I'm only a knee doctor, and you have back pain, you're going to have to go to my back doctor. I'm like, I'm pretty sure as a doctor, you learned the whole entire body. And I'm pretty sure, yeah, you're not going to go do surgery on someone that has back pain when you're a knee specialist, but you've got to look at everything. And there's a lot of times you know enough from the back to be able to help them, or at least like, get into the right place, versus saying, I'm only going to look at the knee, and then I only look at the hip, and then I'm only going to look at the back. So that's a big problem. Only looking at the injury one way. So here's some great examples. Like, you go to a massage therapist because it's going to help because my tissues are tight, and that's all they look at. So my question would be like, well, why are your tissues getting tight? So if you do massage and things and your pain comes back again, it's because you're not getting to the source of the problem. You're just treating a symptom. Now, in our office, we do soft tissue work, but we do it in conjunction with so many other things because we're looking at the whole big picture. Or we see this all the time with a lot of other physical therapy offices. They only do strengthening. It's the first thing. Like, we have someone coming in tomorrow and all they did was strengthening. And I'm like, did they not look at this area and this area? Because I have a feeling that you have some problems there. And they're like, no, we just did strengthening exercises. So that's a problem. Or they're only going to do injections or stem cell. They're really not looking at the whole big picture, and only looking at the imaging and basing their whole decision off that. These are other issues that we see with healthcare providers. Anything else you missed?
Yeah. So, and when, actually, I completely just forgot me. You can keep going.
It'll pop back up again.
Yeah.
So here's a success story of someone avoiding a surgery that was literally scheduled. And this was a friend of, a friend. It was the husband of one of our patients, or the wife's husband of one of our patients. And of course, you go and the wife's like, you need to go in and see Empower. You need to go in. We don't listen to each other. I don't know what it is about it, but it's like this whole marriage code. You have to have someone else tell you that you have to go and do something. Well, it was kind of one of those things. And he went to the doctor because his knee was really bothering him. They were taking care of puppies. And so he was on his knees, kneeling all the time. And he woke up one day and had just severe knee pain. He went to the urgent care. They gave him some medication that didn't work, still having some pain. So he went into the orthopedic surgeon's office and said, yep, we need to go ahead and do surgery because you have a torn meniscus. And his wife called us and gave us all the information. And I was like, let me call him. I'm like, please, please, please come into our office and let us just give us one visit at least so we can do an evaluation, because there's some things like at your age, especially with the way you're doing it, that can mimic a meniscal tear. And it may not be that at all, but we'll know fairly quickly. And so that's what he did. He came into the office. Sure enough, is what we thought. We gave him some knee mobilizations, and he literally, like the next, within a week, he was like, I'm so much better. And he canceled his surgery. And then we went on and finished up the rest of his therapy, but he didn't need to have the surgery. And that's what, he was literally, had it scheduled. So it's this common things that we see in our office all the time.
Yeah. So I remember what I was going to say. So another key piece that people miss, providers miss, and PTs miss, is making sure that like you have the education of why you're doing what you're doing. Like Stephanie and I can tell you every single thing we give you and why we're doing it and how it's going to help and why you need it. So, if you're going to a place and that's not happening, you're like, I don't know why I'm doing this. And I do this every time I come in, like, that's probably not going to help you. It might help you like get moving, but it might not help you get to the source of the pain, the problem, and get better faster. So just like another key thing, like you got to know why you're doing what you're doing.
Yeah, no. And that's a great point, because you don't get it. Like that's usually when we have people that come in from other like PT clinics or wherever they've been. One of the questions that we ask is, what have you done? What have you tried? Let's get into all this, because it gives us clues as to not go in that direction either. But I'll ask them, like, do you know why you did it? And they have no clue. Where we really get into like everything, like you're doing this exercise because, it may look similar to something you've done before, but that's not why we're doing it. We're doing it because of this and this. And so you'll get that education piece and it'll make sense. And honestly, when you know why something is going on and it makes sense in your brain, you're going to be more likely of wanting to do the exercises, because you're like, okay, this makes sense. I'm going to keep on doing this. This is a story. So this is someone that's in our office and she's finishing up therapy right now, but it's such a great story. And it's another one of those stories where she was having knee pain and we had to start at her hip before we could even get anything going. So we're going to hear her story. Hey guys, this is Stephanie here with Empower Physical Therapy. And today we have Nancy, and I'm so excited for you guys to hear her story, because I know you guys hear me all the time where I say where the side of the pain is may often not be where the source of the problem is. And she has that exact same story with knee pain. So let's get started. Tell us a little bit about like your knee pain, the history of it, what it was stopping you from doing, how long you've had it, all that good stuff.
My knee pain, I've had surgeries on both knees, and my knee pain has gotten worse of late. And the surgeries were, well, one of them was, I don't even want to tell you how many decades ago, but I had one a few years ago when I tore an ACL, which is what I've decided is the only real reason to get knee surgery, is if you do something that drastic.
Oh, absolutely.
And it was to the point I walked the dog every day and that was okay. But when I don't have that many stairs coming to my house. I have 3 steps coming from the street, and then I have 3 steps going to the porch, front porch when I walk him. And I was literally kind of lurching my body up the stairs because it was hard for me to climb stairs. I really noticed it a few years ago when I was in Europe, because there's stairs everywhere. And it was really, I mean, there was just one thing, I think it was in Rome. It was a memorial to their only emperor, and it was all stairs. It was like 8 stories worth of stairs. And I went, there's just no way I can do that. You know, there's no way. So I didn't do that. I took pictures from the ground. Luckily, it wasn't a museum or something I really wanted to see, but it holds me back. And I was just tired of it. And Stephanie had Stephanie had worked wonders on my body. How many years ago was that?
Oh my gosh, probably 3 years ago, which is crazy that it's been that long.
Yeah.
It seems like it was just yesterday.
It does. It was more than 3.
It could have been. Yeah, it totally could have been.
It was like 5 or 6, I think.
No, I don't think no, I haven't been open that long.
You weren't open.
You were doing house calls. I wasn't open in my office, but I think it was probably 4 years ago.
Yeah, it had to be, because I had Grover.
Yeah.
My dog. And he loves Stephanie. But yeah, so I went, you know, you're tired of this, you're tired of your knees just hurting. I've been doing yoga, but they still hurt. And I wasn't doing it correctly because I just didn't have any strength in them. And no matter how much I did yoga, it wasn't helping.
Yeah. What were some of your fears if you didn't get this solved?
That it would really, I mean, I'm retired, and what I was totally looking forward to, who knew about the pandemic, but what I was really looking forward to was travel. Yeah. And I did. As soon as I retired, I was like all over the place, and it was wonderful. And I was really worried that that was going to be, here was my big plan, and I wasn't going to be able to do it.
Yeah. And, you know, a lot of times people think that, oh, I just need to get more strength in it and it's going to be able to help me. But you've got to go and take a step back, because if you can't actually move, like if the knee doesn't move, if the hip doesn't move, if the back doesn't move, if any of these pieces are a part of what's going on, and your muscles won't fire, like they literally, you can't get stronger. So you can do all the strengthening exercises you want to do and be like, but I'm not getting any better. And that's why.
Yep. That was happening.
So since coming in, and I know we're not completely done with therapy yet, we are, you know, midway through it. Tell us now, like how you're feeling and what's going on since then.
Well, you really pinpointed my left hip as a part of the problem, and opening it up, and and doing that, it's like, now I climb stairs like a normal person. I'm not lurching my body forward to have my weight pull me up.
Yeah.
And that's huge. Yeah. And number 2 is, you know, I can see how my body's acting in yoga, and it's like, oh, look, I can cross do a cross-seated, whatever you call that.
Crisscross. Yeah.
Crisscross sit. And I can do it fine. And I don't have to be on a bolster, or I don't have to be on 2 blankets. Yeah. And even my yoga teacher commented, he said, you've gotten much more limber. Your hips have got, and he said, it's your hips. Your hips have gotten much more limber, I can tell. Yeah. So that's what I want to hear. You know, that's the kind of thing.
And a lot of times we end up stretching the wrong way. We think that, oh, I've got to move my body this way so that I can get it to open up. And that's more of like, okay, I'm going to stretch the muscle so that I can actually move it. And it's not usually the case. A lot of times it goes back to, you know, that first phase of physical therapy. You have to improve the mobility of the joints. And often the way we stretch it is opposite of what we think that we need to do. And that opens everything up. And I mean, I remember the first time I was like, whoa, your hip, like, I mean, it just wasn't moving. And it was amazing when we started getting it moving, even on that first visit, the knee dropped, like your knee range of motion improved significantly. Now we've had to address some knee stuff as well because it's all connected, but a huge component, if you went to any other part of your body before, like going to the knee first and not getting to the hip, we wouldn't have the results that we had.
Right. And when that thing about you're stretching the wrong way, or, you're not, that was like a revelation for me.
Yeah.
I suddenly realized that it was the back bend that really helped stretch out that hip, and not
not bending forward. Yes. Yep. And then it opens up the bending forward. Like, when you usually can find one direction, and sometimes it's a combination, but usually you can find one direction that opens up everything else. And it's really getting to someone that understands, like, A, where is it coming from? What do we need to focus on? And then what are the right stretches? Because you can go and YouTube and Google things all you want. A lot of times it's the wrong advice for you. It may be the right advice for someone else, but you really, don't waste your time and like you being able to get back to doing the things that you love to do, because you're going to try to fix something on your own. You can see, how quickly you can progress when you get to someone that understands what's going on. So, which is my next question is, did you ever feel like you could progress this quickly when this has been going on for this long?
No, it was shocking. It really was shocking. After the first session with you, it was shocking.
Yeah. And it doesn't mean the first session she was fixed magically, because people sometimes come in and like, well, I want to get the results in like one visit. No, it was like one visit, which leading to the next visit, which leads to the next visit. Like each visit leads to itself to really build upon it and get you back to what you want to do. So what would you tell someone if they're on the fence about coming in to see us?
I've done a lot of physical therapy because I've done stuff to my body my whole life, right? And so they send you to physical therapy. I had one physical therapist that literally caused all this issue. She just really hurt me.
Yeah.
Really hurt me. But most of them haven't, but they're really all about strengthening. And if that's all you're trying to do, that's fine. Yeah. So you're strengthening different muscles in your body. Nothing's really healing. And that's what I keep saying about you when I talk to people is if you need a healer, you need to go to Stephanie, because the other PTs are good and for what they're doing, but they're not healing. They're just strengthening. Yeah. And I think that's the biggest difference for me is that you really look for what the root cause is and what we can do to heal those issues so that you don't have the other issues. Yeah.
We miss so many steps, and it's what happens in healthcare. And the first step really is that mobility piece of it. And if you miss that step, it could be that everything moves great. Then we've ruled that step out. Now we can go into the strengthening phase step. But if you go straight into strengthening and you don't check the mobility piece, you'll never get the resolution. If you go and only look at the site of the pain, like, only the knee pain, and you're not looking at like other areas above and below, that how the ankle moves, how the hip moves, how the back moves, you're missing a piece to it. And so it's really looking at the totality of everything to get you back. And that's what our healthcare misses, because they don't have time to spend with you. A 5-minute appointment with a doctor is not going to give you the results. They're just going to do an image and say, here's the picture. Yeah, you have arthritis and let me give you an injection or you need surgery, versus sitting down and really spending the time. You go to most other physical therapy and they're in there with like 2 other patients at the same time or three. And you can't even like sit down and really spend the time to figure this out. Where here we do have the time, which means you don't see us for, 30, 40 visits for something like you do for a traditional PT, seeing 2 to 3 times a week. We really see people once a week, sometimes twice if we need to initially at the very beginning, but we're really, really guiding you and teaching you what you need to do. So you're really going to not waste your time and money by getting the results by coming in and actually, seeing us.
Exactly. That's how I feel.
Yeah. Well, I'm so glad. I love, sharing people's stories because it really helps other people see themselves. And so many people are just disheartened with our healthcare system and like, there's no one that can help me. They're going to hear your story and be like, oh my God, that sounds like me. Maybe this place can actually help. And so we're really excited to get your story out there.
Good, good.
Okay. So what do you take from all of this? Is that most injuries do not require surgery or medication. So let me just kind of preface this. Most of the time when someone comes into our office, and this is like over the last 20 years, and you ask them, what did you do? How did you hurt yourself? The majority of the time, they're going to say, I'm not sure. It just started one day. When you have people saying stuff like that, rarely do those cases need surgery. Now they can, I mean, we could find some red flags and we do, I have on some people, but rarely do they need surgery because it wasn't from a fall. Like if you have a fall and there's an automobile accident, and you've broken something or you've torn something, those things are going to need some surgery. But most of the time when you're not really sure what's going on, you don't need surgery. Most of the time, your pain comes from somewhere else, and it can be several places. So you've really got to look at the whole big picture. MRIs and x-rays do not always help in guiding treatment and resolving your knee pain. They actually can do more harm than good. And it's very expensive. Most MRIs, oh my gosh, it's like $1,500 for an MRI that doesn't even make you feel better. It's just a picture of you, not even in a weight bearing position, which is usually when we hurt. We're lying down and it's just taking basically a very expensive selfie. That's what I call them. And then really seeing a specialist to help you figure out where the source is coming from, you will get faster results. Always, always, always when you get to the right person that can help you understand kind of what's going on. And then there is hope that you can get back to living your life again and doing what you love to do. Honestly, most of the people that come in our office have tried everything. Nothing's really worked. They have lost hope that they can actually get back to doing some of the things that they love doing. And it's very rare that we can't figure it out. There have been a few cases, but it's very, very rare. And usually we know where to send people to because we have kind of our referral partners of people that are very holistic that can help get to the source of what's going on. So that's kind of how we wanted to make this office operate, is really taking it from like a lot of different sources. So we have someone, Hillary, you have anything else you want to add?
No, I mean, I think you pretty much covered everything, but I really believe something's happening with the.
Yes, I got it.
Okay. That, if you're coming to someone who's going to look at the source of the pain, you're going to get better faster. And we're going to be able to figure out, hey, this isn't working faster and get you to someone who can help you. And that's the main goal. We're never going to be like, oh, we can't help you by we'll get you to somebody, we'll research, or we have a lot of different doctors and specialists that we work with too.
So we have a couple of options for you. One is that we have opened up some spots over this week and next week, where you can actually come in and talk to one of us and what we call kind of a free discovery visit. So you can sit down, we can get more specific as to kind of what's going on with you. And it's really to help you make a better decision about your health. And then if you decide that, yes, you know what, I want to come here, this is the place, I feel like I'm going to get help here. We are actually, if you've come on to this talk, we're actually going to give you $100 off the evaluation price if you use that within, or really schedule it within the next 15 days. It doesn't have to be in the 15 days, but scheduled within the next 15 days. So you'll get some money off for doing that. So I'm going to stop the recording.